Let's discuss about autism. Autism or autism spectrum disorder, that is ASD, refers to a broad range of conditions characterized by challenges with social skills, respective behaviors, speech, and nonverbal communication. According to the Centers for Disease Control, autism affects an estimated 1 in 54 children in the USA, that means United States today. Autism causes and risk factors: abnormal body posturing or facial expressions, abnormal tone of voice, avoidance of eye contact or poor eye contact, behavioral disturbances, deficits in language comprehension, delay in learning to speak, flat or monotonous speech, inappropriate social interaction. There is no known single cause for autism spectrum disorder, but it is generally accepted that it is caused by abnormalities in brain structure or function. Brain scans shows differences in the shape and structure of the brain in children with autism compared to in neurotypical children. ASD affects different people in different ways. Some people can't speak or learn. Their behavior may seem strange. They may avoid other people. They may pace and move their bodies in unusual ways, like flapping their hands. They may repeat lines from TV shows or movies. Why the types of autism shifted to one diagnosis? Prior to that, they were categorized as 5 different types of autism: autistic disorders, pervasive developmental disorder, not otherwise specified, PDD or NOS, Asperger syndrome, childhood disintegrative disorder, and Rett syndrome, that is a rare genetic disorder. Let's know, what age does autism appear? ASD begins before the age of 3 and lasts throughout a person's life. Although symptoms may improve over time, some children with ASD show hints of future problems within the first few months of life. In others, symptoms may not show up until 24 months or later. Social communications and interaction symptoms: inability to look at or listen to people, no response to their name, resistance to touching, a preference for being alone, inappropriate or no facial gestures, inability to start a conversations or keep one going. Autism runs in families. ASD has a tendency to run in families, but the inheritance pattern is usually unknown. People with gene changes associated with ASD generally inherit an increased risk of developing the condition rather than the condition itself. Autistic people don't have feelings. With autistic people cannot feel or express love or empathy. Some people with autism need help developing empathy because they have a difficult time guessing what other people might be feeling based on their body languages. How do kids get autism? Sorry. Genetics several different genes appear to be involved in autism spectrum disorder. For some children, autism spectrum disorder can be associated with a genetic disorder such as Rett syndrome or Fragile X syndrome. For other children, genetic changes, mutations, may increase the risk of autism spectrum disorder. What's the difference between autism and Asperger's? Characteristics. It's based on characteristics. What distinguishes Asperger's disorder from classic autism are its less severe symptoms and the absence of language delays. Children with Asperger's disorder may be only mildly affected, and they frequently have good language and cognitive skills. Can TB cause autism? From the data, October 18, 2006, too much TV time for toddlers may trigger autism, according to a study by Cornell business professors. Over the past few decades, there's been an amazing increase in the number of children diagnosed with autism. How can you prevent your child from getting autism? While you can't prevent having a child with an autistic disorder, you can increase your odds of having a healthy baby by doing these lifestyle changes. Live healthy, have regular checkups, eat well-balanced meals, and exercises. Make sure you have good parental care and take all recommended vitamins and supplements. What increases autism risk? Problems from pregnancy or birth. Mothers who had problems during pregnancy or birth may raise the risk of ASD risk in their children. This may include babies born too early. The risk is higher with earlier birth, especially at 26 weeks of pregnancy. This is vital point, remember. Is it okay for my 6-month-old to watch TV? Yes. Watching TV is better than starving, but it's worse than not watching TV. Good evidence suggests that screen viewing before age 18 months has lasting negative effects on children's language development, reading skills, and short-term memory. It also contributes to problems with sleep and attention. Can cell phones cause autism? Cell phones don't cause autism. Over the years, the media has reported on theories that electromagnetic radiation created by cell phones and Wi-Fi networks are behind the rise in autism. Can mild autism cured? There is no cure for autism spectrum disorders, and there's currently no medication to treat it, but some medications can help with related symptoms like depression, seizures, insomnia, and travel focusing. Does milk affect autism? More research is needed, but scientific studies have shown that many autistic kids improve dramatically when put on a diet free of dairy products. One study of 20 children found a major reduction in autistic behavior in kids who were put on a casein free diet. Casein is a component of cow's milk. So, autism, it's abnormalities of brain of a children. So, you should make your behavior with the children like a parental, and your children may develop autistic disorders. Autistic disorder may have no cure remedies, so you have to just develop their behavior and their activities by your parental service. Thank you all. See you again. Bye.